So we all have to make these difficult decisions about what we want to do with our lives, how we want to spend our time. And I think the effective altruism perspective helps us organize our thinking, focus our thinking, so that we're not just making like gut level decisions, not to discount gut level decisions, but again, to supplement them.
Welcome back to Partnership Connections, a child welfare training and education podcast for those already working in or with an interest in working in child welfare. My name is Dan Brazier. I'm the project director for the learning partnership between the Rhode Island Department of Children, Youth, and Families, or DCYF, and Rhode Island College. Our desire is to bring information from experts on a variety of topics, all at no cost, to hardworking professionals and others. Joining me again today as co-host is Holly Pacheco from DCOIF. Holly, welcome. How are you?
I'm great. Thank you.
A- we're talking about effective altruism today. Do you have any idea? Do you have any thoughts about what that might be, or like what you kind of, if you looked at this, have you listened to some other podcasts? Have any thoughts about this? Are you scared? I'm a little scared. I'm gonna be honest with you.
You're scared? I'm not
Yeah.
scared. I'm
Okay.
open to learning more, and I don't have much of a background in learning about this topic, so this is
Okay.
all new territory for me.
Gotcha. I'm a little bit scared, but I'm a little bit optimistic. So I don't know. It'll be interesting to unpack this topic. And we are privileged to have as a returning guest Dr. Frederic Reamer, who has been on the faculty of the School of Social Work at Rhode Island College since 1983. His research and teaching have addressed a wide range of human service issues, including mental health, healthcare, criminal justice, public welfare, and professional ethics. He has published 25 books. I don't know if that number is still accurate or not, and more than 190 journal articles. Same for that, book chapters and encyclopedia articles. Dr. Reamer, welcome back, friend of the pod. Good to see you again. Thank you for doing this.
My pleasure. Thanks for asking me.
Yeah, of course. And before we begin, please note a disclaimer that the views expressed by the hosts and guests of this podcast are their own and do not necessarily reflect those of the college or DCYF. So tell us what this is. Tell us what effective altruism is exactly and what led to your interest in this topic.
Sure. Well, it's a term, as Holly suggests, that a lot of people may not be very familiar with. So I hope this discussion is illuminating. Work on this phenomenon, effective altruism, began in, I would say, around 2005 ish. So about 20 years. So it doesn't go back all that far. So, what is it? If we boil it all down, it's a philosophy, it's a social movement that uses empirical evidence and reason, like cognitive reasoning, to identify how we can do the most good with the resources we have. And we know that in social work and child welfare, we never have enough resources. So the goal of EA, effective altruism, is to do the most good we can with the resources we have in our efforts to, and I know this sounds idealistic, but this is what brings us to this kind of work to reduce suffering as much as possible. So what EA does, and I'll just use that abbreviation EA, what it does is it applies evidence, empirical evidence, and reasoning to determine the most effective ways to improve the world we live in. And so it asks people to go beyond just like doing good, to think about people who are drawn to child welfare, people who are drawn to social work. Nearly all of us are drawn to this work because we want to do good, to use the vernacular. But EA says that's not enough. You need to think about doing the most good you can, maximizing our efforts and using, and I know this stuff seems like, kind of academic, but using tools like cost benefit analysis and impact evaluation, identifying what are neglected problems that need our attention. One other little historical detail: the term effective altruism is ordinarily linked to the work of a very famous philosopher by the name of Peter Singer. If you read moral philosophy, you're going to come across the name Peter Singer. He taught at Princeton University for many, many years. So he kind of put out effective altruism on the map. But only recently, have we seen efforts to link effective altruism with social services, human services, child welfare, social work. That is much more recent, and that's the kind of work that I've been doing that's led to this conversation.
So your interest is it accurate to say that your interest is because you're a social worker, or because of particular interest you have within the field of social work that led to your interest in effective? How did you kind of stumble upon this or upon this philosophy?
Yeah, great question. So I would say there's several variables in that equation. So yeah, I'm a social worker. And I'm a social worker who has devoted much of his career to the exploration of thinking about, writing about, lecturing about ethical issues, moral problems. And I didn't get into social work in order to focus on these issues. I became a social worker decades ago, primarily to work in prisons. That's been my passion. I've spent 27 years of my career working in federal and state prisons. And doing that kind of work, I encountered many, many moral and ethical problems. And that's what led me down this rabbit hole. Well, as somebody who does pay attention to literature in moral philosophy and professional ethics, by the way, those are kind of two related but separate things. Moral philosophy is kind of the broad intellectual inquiry that you might associate with names like, Socrates and Plato and Aristotle and John Stuart Mill and Jeremy Bentham and Immanuel Kant, the grand Western philosophers. Of course, there are also Eastern philosophers, Confucius and so forth. But I've also spent much of my career trying to apply core ethics concepts, philosophy concepts to social work, to child welfare, other aspects of the human services, the real applied linking of core philosophical ideas to the work we do in the trenches. And as somebody who's paid attention to this literature, I noticed a number of years ago that there was this relatively new movement, attributable again primarily to Peter Singer, called effective altruism. And it has dawned on me, um, you know, I wouldn't say it was a 100-watt light bulb, maybe it was like a 10-watt light bulb, but it dawned on me that, gee, these ideas have a lot of relevance to the work we do in child welfare and social work more broadly. And I discovered that nobody's really looked into those links directly. And so that's what I've done. And I've written about this, and here we are having this conversation.
Yeah. So what have you uncovered as like some of the biggest implications for social work practice, and maybe more specifically child welfare as well, but just in general social work? What are some of the biggest implications that this philosophy might have?
Yeah, so this is the kind of fertile territory that I've been exploring in recent years. Like, what does effective altruism, EA, have to do with the work that we do? I would say, from a social work and child welfare perspective, the appeal is that EA pushes some really familiar values like service to the public and social justice and professional competence. EA pushes us toward more explicit questions about impact, about equity and resource allocation, empirically supported interventions, like what really makes a difference. And what I've done in my work is to explore the ways in which EA challenges us to confront some, let's admit it, some uncomfortable questions about priorities, about efficiency, about trade offs, especially in environments where there are limited or scarce resources. And let's be frank, I don't know that there is a human service setting on planet Earth that has enough resources to do what we want to do. So while in our profession, we typically emphasize things like dignity and contextual judgment, like making difficult decisions given the contexts in which we work. What EA pushes us toward is outcome analysis, or what EA experts call comparative outcome analysis. In English, that's kind of jargony. In English, if you think about what our goals are in child welfare, in the human services more generally, what are we aiming to do? And what's the evidence that we are actually succeeding? So it's not that EA says we ought to abandon our core values. Of course not. but that we need to critically evaluate how evidence and cost benefit reasoning, what philosophers call moral pluralism, in English, different perspectives on difficult moral problems, how they can coexist with our commitment to equity and client self determination, anti oppression. And I know these are grand ideals, but I take these things very seriously, and I'm assuming our listeners do as well. So let's drill a bit more deeply and apply this to child welfare. What EA suggests is that we ought to be investing more heavily in preventative and what we call upstream interventions, poverty reduction, substance use treatment, early family support, trying to prevent the big problems rather than costly downstream responses like foster care, which we all know is a challenge, congregate residential placement. So effective altruism would basically prioritize interventions that have really strong empirical support, measurable long-term outcomes, even when those investments are politically not real popular, they're less visible. That's what EA is all about. There's a lot of number crunching that goes on. I realize it may not be appealing to a lot of child welfare and social work professionals. I've spent much of my career teaching statistics. I know that the typical graduate student doesn't camp out overnight before the first class because they're so excited about taking a course in statistics and data analysis. I get that. The stuff can kind of make your eyes glaze over when you think about things like standard deviations and partial correlation coefficients and discriminant function analysis and multiple regression and all those sorts of things. But don't we want to know what works when we put all
Well,
this time and effort into helping people? And so you got to
yeah.
measure this stuff.
Yeah. Yeah, well, you use the word comparison. So an example that I wanted to give you, you also mentioned foster care, right? So what would the EA philosophy say? Is it better to become a foster or adoptive parent, or is it better to donate money to prevention of child abuse and neglect? And can you give us maybe some other examples where we might be looking at comparing where we can make the most impact? Maybe what would the EA philosophy say about those types of decisions that not even just professionals within the system make, but people in the general population that might be
Mhm.
considering, how do I support kids and families, right?
Right, right. And they may not be professionals. They're just nice people who care about vulnerable kids who think about becoming foster parents. So that's a great case example, foster parenting. So EA, if you take the deep dive into the literature, what EA does is it often compares direct work, recruiting foster parents, training foster parents, trying to prevent foster placement disruptions, direct work in the trenches, and the bigger picture philanthropy work, right? The policy change that we know is often so relevant to preventing the kinds of problems that lead to the demand for foster care. So, what EA asks is a kind of a bottom line question where a particular person's comparative advantage, again, more jargon, but we're comparing lots of options, right? Foster care versus donating money versus broad policy changes, systemic changes in the culture to try to prevent poverty and abuse and trauma that leads to foster care demand. EA asks, well, where does a particular person's comparative advantage lie? And what would happen if we didn't take that path? What in the trade is called a counterfactual. What's a counterfactual? What would happen if we didn't take one of the options available to us? So, in child welfare terms, becoming a foster parent may have extraordinarily high impact in certain circumstances. We know that we're providing homes for kids who've been exposed to trauma, who don't have stable living environments. That stuff matters, right? At the retail level, let's use that term. At the retail level, the impact can be extraordinarily high, especially in communities with severe foster placement shortages, for youth with very complex needs. And especially if the caregiver, the foster parent, either by virtue of their sort of natural instincts or through training, they bring a trauma-informed, culturally sensitive approach to their work with foster kids. So that's great. But for others who are not in a position to be a foster parent in these high need circumstances, well, EA would say you can think about donating money to highly effective organizations. So that's where the research comes in. Like, how do you define highly effective? What are the metrics? And I'll get into that a bit later. Um, Highly effective organizations. Support those organizations. For example, organizations that support family preservation, legal advocacy, to be sure that kids who have needs get those needs met. Evidence-based parenting programs. If you look at the research, some, not all, of these programs produce terrific outcomes relatively efficiently. Some of them do not. And so what EA says is be very selective. If you are not in a position, let's say, to be a foster parent and you're willing to donate some money, take a look at the research. And I'll tell you about some websites where you can actually look up organizations that do this stuff, and you can look at the data, the best available data on how productive every dollar invested is in producing the outcomes we want. And as a donor, you might say, oh, look at those outcome data. I am more inclined to give my money to organizations A, B, and C because they seem to get more bang for their buck, so to speak, and organizations D, E, and F, not so much. So that's what EA does. It provides lots and lots of outcome data so that we can make choices. Here's the bottom line. The EA literature says there's no single right choice. Like, is it better to be a foster parent? Is it as opposed to donating your money to one of these organizations that supports family preservation or tries to prevent poverty that leads to foster placements and all that sort of thing? There's no single right choice. The question each of us has to ask and answer, according to EA, is where do your skills, the resources you have access to, the context in which you live and you work, which of those lead to the greatest expected benefit to, in our case, children and families? That's the EA perspective.
One example of EA is conducting research into what the world's biggest problems are and how we might prioritize them. What might the EA philosophy say about how decision-making and maximizing resources is done within child welfare systems?
Yeah, well, that's a big one. That's a big one. How many hours do we have? So the way I think about this, again, my goal has been to try to link these very kind of 30,000 foot concepts about effective altruism with the very practical stuff we do in the human services, in child welfare, and in social work. So think about lenses. We look through lenses. And I think there are two really important lenses through which we need to view these issues. So forgive the jargon, but in the moral philosophy world, there's an awful lot of work on what we call distributive justice. So that's a fancy term, distributive justice. What does that mean in plain language English? It's if you work in a domain where there are limited resources, and I assume we would all agree, we work in a domain where there are limited resources, sometimes very scarce resources. So distributive justice asks a very challenging question. How should we allocate those resources to meet the needs of people who need assistance? How do we allocate those resources in ways that are most effective? Like, who gets what and why? Those are questions of distributive justice. And one of my books is entitled The Philosophical Foundations of Social Work. It's a kind of eggheady book. And in that book, I discuss a lot of core philosophy concepts regarding moral philosophy and political philosophy and the philosophy of logic and aesthetics and all that. But I have a large section in there on so-called distributive justice, where I take a look at the philosophical theories about how we ought to allocate limited resources. And if you read the philosophers, they say, well, there are different perspectives on this. You can, if you have limited money, you just, take a look at all the people or all the organizations you want to give it to. And, your numerator is the number of people or organizations you want to fund. Your denominator is the amount of money you have, and you just divide it up and you spread it around equally. Well, that's one distributive justice perspective. But I don't know that in child welfare and in human services, we'd be satisfied with that because we know that some people have more compelling needs than others. So this principle of equality, equal distribution, equal allocation, for a lot of us doesn't work. So another perspective is need. You kind of rank order people. Easier said than done, but in theory, you rank order people. Like who is most in need and they get prioritized. Kind of a triage approach to allocating resources in child welfare and human services. Other people argue, well, you got to add another factor, like who's been discriminated against in the past and who's been oppressed, what we might call affirmative action. There are all these different perspectives in the philosophical literature. And so when I think about applying EA to the work we do, again, in the trenches, I think a lot of what we have to do is think about distributive justice, like which perspective do we find appealing and why? When we ask the question, like who's going to get what and why? And we need to do this in a principled way. Does that mean everybody sitting around the table is going to agree? Probably not. But I would argue that, in the real world, administrators at DCYF, at residential treatment programs, outpatient treatment programs, you name it, they have to make decisions. They have limited budgets. They have to make decisions. And so we shouldn't just throw spaghetti at the wall. We need to think carefully about which principles, which distributive justice concepts are going to guide these decisions. That may seem very academic, but to me, that's what we have to do. This is the real world. And let's have those debates. Let's have those discussions. Is it the case that everybody's going to agree in the end? Probably not. But I don't know how else to do it. I think that's what we have to do. And EA encourages us to look through that distributive justice lens and, in addition, add this concept of empiricism, looking at credible evidence of effectiveness. Like, let's make those decisions, not just based on broad philosophical constructs, but based on data, credible evidence. And I use that word credible deliberately because not all research is credible. A lot of it has, biased samples and questionable statistical methodologies, and it's got to be credible. But if we can identify credible research, credible evidence related to child welfare, where the outcome variables are like, gee, did we do any good with our efforts, with the money we've spent? I think that's how you do it. You link this distributive justice perspective with the empirical evidence perspective. So a couple of practical applications. Let's think about everyday practice. We have to ask questions, I think, like which clients, which communities are most disadvantaged? I mean, that's my bias. Not everybody may agree with me, but I think we have to think about, given limited resources, which clients, which communities are the most disadvantaged. It's kind of like being in an emergency department at a hospital. You can't treat everybody who comes through the door equally. It doesn't work. We might want to, but we know it's impossible. And there are some people who come through the emergency department doors who simply have greater needs. They are bleeding out. They have had a stroke, and they, I think we would all agree, need to be seen before the person who maybe fractured a finger playing softball, right? Not to minimize the pain associated with a fractured finger. Of course, that can be very painful. But I think we would all agree that when push comes to shove, you got to deal with the person who apparently had the stroke or is bleeding out. They come first. That's what triage is. It's a French word meaning to sort. And I think Effective altruism takes that perspective and says, okay, which clients, which communities are most disadvantaged? That's got to be our priority. And here's the empirical part: which interventions measurably improve their well-being for each dollar, each hour, each staff person we invest in this.
So would you recommend then to the individual, say, social caseworker, investigator, frontlines, social worker within child welfare to use your word lens to their day-to-day practice, and say, how can I maximize my impact on the families that I'm working with? Am I maximizing the impact? What could I do differently in my day to day? And thinking about this philosophy, would that be helpful for them, or do you think it would be too overwhelming?
Well, I think the obvious answer to the question is yes, of course, people ought to be doing that. Now, let's face it, caseloads are big, resources are limited. How much time does the typical child welfare worker have to just kind of sit back, put their feet up on the desk, and reflect in this conceptual way about effective altruism? I mean, let's get real here. On the other hand, of course, every practitioner, in theory, I trust we would agree, ought to be reflecting on, am I spending my time efficiently? Am I really prioritizing appropriately? Because I have limited time. We don't want to waste our time. So we have to think about these issues. And I don't think, I'm sharing my own bias, it's enough for us to just use our gut instincts. I mean, gut instincts are important. I wouldn't deny that. But I also think we need to supplement, not replace, but supplement our gut instincts about how we're spending our time, the effectiveness of our efforts, with this kind of hard intellectual, conceptual analysis, application of research data on the work we're doing. So let's take as an example, let's suppose someone at a DCYF is deliberately applying a trauma-informed care approach in his or her or their work with kids in foster care. And, all of us or most of us are aware of trauma-informed care. So we get some training in this. We try to implement these principles and these techniques and all that. Well, great. But don't we want to know whether that tends to make a difference? Shouldn't we be looking at the data? I understand it's dry, it may be kind of boring, but doesn't it make sense in a compelling way to look at what the research says? And that's what effective altruism does. So let me say a little bit more about some of the practical components of EA with regard to this example. Um, so EA says, look at key variables. So let's take the example of the DCYF worker who's using trauma-informed care as a conceptual framework to address issues related to kids in foster care. EA, I know this sounds a little academic, would say, take a look at four things. Take a look at the problem, meeting the needs of kids who need out-of-home placement. It says, take a look at four things. Scale, like how big is this problem? And I think we would all agree it's pretty big. Number one. Number two, severity. Severity. How severe is the problem? And let's face it, if we look at the ways in which we spend our time in the human services, there's some variation there with regard to the severity of the issues we're focusing on. I mean, they're all important, but some more important than others, perhaps. Neglect. That's the third factor. To what extent has this issue, this phenomenon, been neglected? And then the fourth factor that EA focuses on is what's called tractability. More jargon, sorry about that. Tractability, Tractability. So, what is that? In the EA literature, tractability has to do with how solvable the problem is, solvability, the degree to which it's solvable if we increase resources. And so we don't want to waste our time. So just to sum up, if we think about decisions we make about whether to remove kids from their homes, place them in foster care, and all of that, EA would say, okay, when you're thinking about allocating resources, money, staff at DCYF, all of that, think about those four things: scale, severity, the extent to which this problem has been neglected and needs attention, and tractability. That's the perspective.
Yeah, thank you for that. I want to maybe take it back to the more macro side of things for a second. What is your thought, maybe on a more national scale, like is child welfare, the system, are there any other
Mhm.
examples where they could be doing things differently, allocating resources, maximizing resources a little bit better, more efficiently, and using this philosophy to help them?
I mean, take a look at all the core elements of child welfare, generally, public child welfare in particular. It's everything from foster care, adoption, to kids who are incarcerated in Rhode Island in the training school, decisions about whether to send kids to residential programs, especially out of state programs, which we know are extraordinarily impressive. And we know that right now there are efforts to expand the resources for residential treatment of kids with severe psychiatric issues within Rhode Island. It's more efficient. You're keeping them closer to home. That's a good thing. I mean, if you just take a look at all of the core components of DCYF's budget, and I'm just talking about DCYF, of course, then there's also the private sector. But take a look, if we had a laundry list of all of the services and the programs, um, EA would say, go through the list. Don't paint with a broad brush. Paint by numbers. To me, that's a good analogy. If you want to be careful when you're painting, you don't take a bucket of paint and throw it at canvas and hope it like turns into something appealing.
Unless you're Jackson Pollock, I guess, right?
Right. I get it.
Yeah.
I get it. There are some exceptions out there, no question about it. And that would sell for a lot of money. And then he could use that money to donate to organizations supported by effective altruism. So there you go. But, for the typical painting that's not a Jackson Pollock kind of painting, you want to be very precise. You want to sort of, if not painting by numbers, I don't mean to insult artists, but you got to be really, really careful. And I think, in response to your question, I don't think we've done a good enough job. I'm not being critical. I understand we have too much to do, too little time, too few resources. So I'm not being critical. But in a perfect world, we would do a much better job of looking through that long list of the services we fund, the programs we provide, the interventions we sponsor, all that stuff. That's a long list. And we would more carefully, sort of the painting by numbers analogy, we would use these effective altruism style metrics um, to highlight what's working, what's cost effective, what's efficient, and what's not so efficient and cost effective. And I think part of the problem is we've had a lot of successes. I think sadly, we often focus on what doesn't work out, disasters, crises, the headlines nobody wants. That's part of the reality when you work in this business. But we've also done a lot of good. We've had major successes. And I think we haven't done a good enough job of documenting them. I think we've undersold some of our very significant contributions in child welfare, regarding helping people who are unhoused or homeless, in criminal justice, the area that I focus much of my career. There are lots of successes. I think we've undersold them. We've got like bad PR. And I think effective altruism can not only guide our thinking, but it can also be leveraged. Like the results of EA can be leveraged when we are trying to convince legislators, people in the governor's office, people in the White House, executive branch, state and federal. We're trying to convince them of what works, what's worth supporting. So instead of just going in there and saying, oh, look, we all care about kids in foster care, give us more money, which is, I understand that. But if we can march in there with EA type data and sell, and I hesitate to use that word in the human services context, but sell what we're doing and convince people it's good PR. It's not only practical guidance and sound guidance. I think for PR purposes, it can be very effective. Like, when I go into meetings arguing for increased funding for program X, if I can put credible data up on that screen in that meeting room, that's a whole lot better than saying, hey, folks, this is a good idea. Trust me, give me money. I'll give you one practical example. I was recently asked to testify before a state legislature, not in Rhode Island, another state, where the legislative commission was charged with deciding whether to parole people from their prison system or just completely abandon parole. So this has been a national debate for many, many years. So ideologically, some people are like, we don't like parole. People can commit crimes, get sentenced to prison, make them serve the time. Others argue parole is important to have as an option because it gives people an incentive to address their issues in prison, thinking that might help them get earlier release. And it can also be cost effective. If you let people out earlier, making sound decisions, serving people in the community is a whole lot cheaper than serving them in prisons, which are very, very costly to run. So I was invited to share my opinions about this issue because I had written a book on the impact of parole. Parole is an option, and that's what led to the invitation. And I didn't just go in there and say, well, for ideological reasons, I think parole is an important option to have, and you ought to implement it in your state. I didn't simply say, I said that, but I didn't simply say that. I used an effective altruism approach. And I said, look at the screen. I'm sharing with you data on the practical impact, the practical consequences that having parole as an option can have on your budget. I talked money because that's sometimes what you need to do. And I talked about cost savings. I talked about recidivism rates. I talked about how, in my opinion, the data indicate that if you make parole decisions wisely, I served on a parole board for 24 years. Not only do you save money, but you increase public safety because you're providing supervision in the community. You're not just saying, okay, you served your sentence. Here are your belongings. Hope things work out. Have a good life. So effective altruism, I think, can be very compelling in situations like that and in child welfare as well.
So some of the things you mentioned, I think, are a good sort of lead into the next question that we have for you about what EA says about choosing careers and measuring
Mhm.
social impact within choosing careers. So what do you think this movement would say about child welfare as a career choice? Are we doing enough to prove that there is, quote, significant social impact by
Mhm.
choosing child welfare and or social work in general as a career? Are we marketing things well enough?
Yeah, great question. And, the reality is we all make decisions. What do I want to do with my life? Do I want to sell insurance? Do I want to become a doctor or a nurse? Do I want to become a social worker? Do I want to own a flower shop? Do I want to stay home and raise my kids? I mean, we all make choices, right? And so everybody listening to this presumably made a decision. They want to spend their professional life, at least at this point. That can always change in the future, but at this point, they want to spend the professional life in the human services, in social work, and child welfare. So, what effective altruism asks is, so of the options in life available to me, where can I make the biggest difference? Now, that doesn't sound exactly like a profound question. I was like, okay, like, duh. Of the options available to me, where can I make the biggest difference? So, but I think if you tease that apart, that question is packed with meaning. So many of the people I know in the human services are here for all the right reasons. Heaven knows we didn't make this choice, most of us, because we wanted to make a lot of money. That's not why you become a social worker or a child welfare worker. I mean, can you do okay, make a pretty decent salary? Yeah. Do you get pretty good benefits? Yeah. But if your goal in life is to make a gazillion dollars, you don't go into social work or child welfare. So just by virtue of being here, we've all made a decision. We want to make a difference in people's lives. I know that sounds idealistic, but I think that's true for all of us or nearly all of us. So then the question is, if you've decided that you want to make a difference in people's lives, then what's the best way to do that? And that's where the effective altruism perspective comes in. Okay, I want to help vulnerable kids. I want to help vulnerable families. What's the best way to do that? And so EA would say, well, there's no single right answer, but here are the questions to ask. Um, Prioritize the different roles. Do you want to be a frontline worker with working with kids and families? Do you want to be a supervisor? Do you want to be an administrator? Do you want to go into politics? We have an opportunity to vote on legislation related to DCYF's budget. You got to prioritize different roles and projects and make a choice, right? And those are difficult choices. EA would say, look at the data on effectiveness and factor that into your decision. And there are lots of options. So we can decide to spend our time advocating for more resources for DCYF and for the private sector programs that DCYF supports. We can advocate for evidence-based policies and funding decisions. Again, we don't want to just throw spaghetti at the wall and hope it works out. We can decide, you know what? I'm going to use my talents to engage in program evaluation, outcomes research. So we know what at DCYF is the most effective. Or you might decide to be a supervisor, to provide training, to do what Stan and Holly are doing. I mean, they've made a decision. They want to spend their time providing education and training. That's a decision. I mean, they're not carrying a caseload at this very moment. They're doing this. That's a decision. And presumably they've made a decision that this can have an impact when you trickle down to vulnerable kids and families. You might decide effective altruism. The research shows that prevention is a whole lot more cost effective than responding to crises. I want to spend my time designing and implementing prevention programs based on evidence. But others might say, you know what? I mean, that's important, but that's not what I want to do. I really do want to work in crisis intervention. That's what floats my boat. Those are the questions we have to answer. But EA, to bring it back to that, would say, okay, if you want to be a crisis intervention worker, you want to work at the retail level, great. Take a look at what the data indicate. Which crisis intervention models tend to be the most effective and cost efficient, given those factors that EA tells us we ought to be thinking about. If you want to do what Stan and Holly are doing with their time at this point in their careers, which could change at some point, I suppose, what does the research say about whether conversations like this, podcasts like this, webinars that they sponsor, is there evidence that these things make a difference? They may be fun to do, they may be interesting. EA would say, okay, is there any evidence that this stuff matters? And I would like to think there is evidence out there that says this stuff matters. So we all have to make these difficult decisions about what we want to do with our lives, how we want to spend our time. And I think the effective altruism perspective helps us organize our thinking, focus our thinking, so that we're not just, just making like gut level decisions, not to discount gut level decisions, but again, to supplement them.
Yeah, I would imagine that it's certainly crossed my mind. Nothing I could really do about it at this point, obviously, but I would imagine, and I don't regret the decision to go into social work by any means. Um, but I would imagine there's probably a lot of social workers out there that say, maybe I should have just gone out and tried to make as much money as I possibly could and then allocated that money to the causes that I care about, right?
And in fact, interesting you should say that. EA says that that's a legitimate thing to do. So if anybody listening to this is interested enough to take a look at the EA literature, there are lots of commentators who say exactly what Stan just said, that for some people, earning whatever they earn in public child welfare or the private sector, which is, pretty good, but it's not seven figures. Okay, that's what you want to do with your life, and that can make a difference, a profound difference. Others say, you know what, given my talents, my skills, here's what I want to do. I want to make a boatload of money doing something in the private sector, maybe on Wall Street or who knows what, unrelated directly to child welfare. And one of my goals is to make a lot of money and then to use effective altruism metrics to support those efforts. I can be more effective that way. I'll go get my MBA from Harvard or Yale or wherever, make a lot of money, and use the effective altruism lens to support the kinds of efforts that people like us work in. So there are, and I can give more detail if you'd like. Let's suppose, hypothetically, I decide, I'm not cut out to work with kids in foster care, with foster parents. I'm not cut out to work in residential treatment settings. I'm not cut out to do crisis intervention work. It's just not who I am. But I really care about these issues. I really do. And I think I have the potential to make a boatload of money as an investment analyst or something on Wall Street. Effective altruism would say, okay, great. I want you to look at a number of organizations that will guide you when you make decisions about which child welfare programs, which human service programs to support with your money. Effective altruism does that. So I'll give you a few quick examples. I know we're short on time, but I'll give you a few quick examples. You can look these up. There's an organization called Give Directly. If you're doing an online search, it's one word, Give Directly, even though that's two words, make it one word, Give Directly. And that's a nonprofit that lets donors send money directly to some of the most vulnerable people in the world to help them improve their lives. And that organization, using effective altruism metrics to guide people's donations, has, the last time I checked, which was not that long ago, has delivered more than $500 million, more than $500 million directly to vulnerable people. And it's not just like standing on a street corner handing out money. It's using effective altruism metrics. Go to the Give Directly website and you'll see that to guide people's judgments. Then there's one called GiveWell. Again, one word, even though it's two words, GIVEWELL. GiveWell Maximum Impact Fund, using effective altruism metrics. GiveWell recommends a list of charities, organizations that are evidence-based, cost-effective, transparent with regard to what they do with their money. And it says, look, if you have money to donate, you may not be working directly in child welfare and human services, but if you want to support these efforts, take a look at our list, which we have vetted and considered giving to those organizations. Another one called the Global Health and Development Fund. You can look them up. They direct money from donors, some of them very wealthy donors, that support projects related to healthcare, behavioral health, poverty, all that sort of thing. Again, using effective altruism. Look at their websites. They actually use the language of effective altruism. Another big one is called effective altruism effective altruism infrastructure fund. That's it. Effective altruism infrastructure fund. And it, using EA metrics, the name suggests that, provides a list of organizations that support the kinds of things we as human service professionals, social workers, child welfare professionals care about. Another terrific, I think, organization is called 80,000 Hours. This is very well known in the EA world. 80,000 hours, you might be thinking, why 80,000 hours? That figure represents the number of hours in a typical adult's career. It's 40 hours a week times 40 years, that's the average, times 50 weeks. Take a couple weeks off for vacation. That's where that figure comes from. 40 times 40 times 50, 80,000 hours. And what 80,000 hours is, that's the name of the organization, they conduct research on which careers have the largest positive social impact. And they provide career advice to help you make those decisions. So I'm thinking about being a social worker. I'm thinking about being a child welfare worker. What do the data show about the impact you're likely to have during the 80,000 hours, give or take, that you're likely to spend doing this work? Another organization is called Rethink Priorities. Great name. Rethink Priorities. And they use effective altruism variables, if you will, to identify, once again, which organizations, in their opinion, provide you with the biggest bang for the buck, given the metrics that we care about. There are others, but the ones I just mentioned, I would say, are among the best known.
Yeah, so sadly, I don't think there are a lot of hedge fund managers or Wall Street folks that are thinking about this when they're looking on how to allocate their own money. But Holly, do you want to ask that last question?
Sure. Okay, last question. In a TEDx talk, Beth Barnes stated, quote, "We have plenty enough resources to fix all the worst problems. We're just not using them right." Do you think society will ever get to a place where more of the, quote, worst problems are solved?
Yeah. Well, another very important question. So Beth Barnes, for those of you who are not familiar with her, she's the CEO of an organization called METR. That's the acronym, METR. Model Evaluation and Threat Research. That's quite a mouthful. METR, METR, Model Evaluation and Threat Research. And so what Beth Barnes does, and she's, I think, a pioneer, is that organization designs and carries out evaluations. And regarding the kinds of things that we care about, right? And so what she says is, as Holly suggests, what she says is, we have plenty resources out there to fix all the worst problems. We're just not using them right. And we need to be more thoughtful, more deliberate, again, using the EA perspective when we make decisions about how to use these resources. And I think Beth Barnes' words capture a core effective altruism instinct, that the main barriers we face. Again, think about child welfare. Now, she didn't comment on child welfare per se. I'm doing that. But what I think she would say is that the main barriers we face are like poor allocation of resources, inefficiency, the lack of focus on impact, but not scarcity so much. I mean, we could always use more. But she would say, focus on your allocation decisions, focus on efficiency and kind of battle inefficiency. Take a look at impact. And that's the work she is doing. And be willing to make some hard choices, which may mean you have to redirect resources away from low impact uses. Like, okay, shift the focus. Now, that's going to upset some people, right? Because you may have to shut down some programs, you may have to reallocate staff. People don't like that. But EA would say that sometimes you have to do that. You can't just say, oh, we like these people. Let's just let them continue doing what they've been doing, even though it doesn't seem to work very well. You may need to redirect resources from low impact uses to prevent the kinds of problems that we deal with in this world. And I think, Beth Barnes, to my knowledge, has not focused on social work or child welfare per se. I do think she probably cares a lot about the kinds of things we do. But here's what I think she would say, that it's unrealistic when we're making these tough decisions to expect perfection. Perfection is wonderful, but not what we're going to get in the world I live in. So I don't think it's realistic to expect perfection. And what I do think is that if I can circle back a little bit, if we can look through those lenses, effective altruism generally, within that, distributive justice, given our limited resources in reality, how are we going to allocate them based on these EA metrics? And empiricism, if we look through those lenses, when we make decisions about budget allocations and budget priorities and which programs we're going to fund and all of that, I think we have tremendous potential to solve some of the worst, most intractable problems we see in this business that affect people's lives. So again, EA may sound really academic, and let's face it, it is academic. But I'm a social worker. And my goal as a social worker and as a social work educator is to take critically important concepts and theories and conceptual frameworks and apply them to the hard work that we do. To me, that's what it's all about. We shouldn't just wind up child welfare professionals and say, go out there and do your thing. We need to approach this stuff as best we can, conceptually, in a structured, principled way. And I think effective altruism is a really useful tool to enable us to do just that.
Yeah, so fair to say that the goalposts will always be there and kind of moving around continuously, but if we can maybe we could get some field goals through, maybe we could get convert some points, even though that those posts are always moving and always a challenge.
Well, to use that football analogy, which is a great analogy, we all know what we want to do. We want to, if you're a field goal kicker, you want to get that ball through the uprights. We all know that. But we also know that it's not going to happen every time. There are going to be some horrible kicks, wide to the right, wide to the left, or some near misses, or it's going to hit the goalpost and bounce off. That stuff happens. And there are lots of variables that affect the likelihood that that field goal kicker from 47 yards is going to get that ball through the goalpost. Wind conditions. Is it snowing? Is it icing? How strong is the offensive line? And how good is the kicker? Well, think about that in terms of child welfare. Lots of variables in that equation that can affect our ability to get the ball through the upright, so to speak, to help vulnerable people. And it'll always be a challenge, just like it's always a challenge for field goal kickers. And effective altruism, I think, can help us gain as much control as is humanly possible over those multiple factors. Is it perfect? No. Can it really help? Yes. And that's the perspective I bring.
Yeah, lots to think about. Um, Final thoughts, final questions, Holly? Anything you want to add? Dr. Reamer, anything you want to add before we wrap up?
Oh, great information. I can't wait to look up some of these sites and see if the careers with
Did you choose the right
positive
career? I
social
don't know. We have
impact.
to go. That's why I said I was a little bit scared
Yeah.
of this conversation.
Yeah. Two things. I'll just add this. What I've talked about is very idealistic. And, I mentioned that a choice that some people make is to make a ton of money, and they don't want to work directly in human services or child welfare, but they want to use the money they make to support the things we care about. And Stan kind of jokingly said, well, there aren't too many people, hedge fund managers who, if I got this right, Stan, who are really interested in the kinds of things we do. But in fact, there are a number of them, but one of them actually used the language of effective altruism to support decisions he made for years about which social causes to support, the kinds of things we as social workers and child welfare professionals care about. He literally used the language of effective altruism to guide his decisions. Sadly, it didn't work out so well. And his name is Sam Bankman-Fried. And he, at this very moment, is serving a very lengthy federal prison sentence. Not because of his work related to effective altruism, but because he ran into some problems with some cryptocurrency decisions he made. He's in prison. So, Stan, I know you said it jokingly, but in fact, there was somebody in that world who really believed, and maybe still believes, in effective altruism. But in some other areas of his life, he made some judgments which didn't work out so well, and he's now in federal prison. So, got to be careful. Those of us who wave the effective altruism flag, be sure you're waving it ethically.
Yeah, not a silver bullet to all solution to all your problems, I guess. So, yeah. Dr. Reamer, thank you again. Appreciate having you back.
Yes,
My
thank you so
pleasure.
much.
My pleasure and my privilege. Thank you, folks, for doing this. And I think the EA data would show that what you're doing with your time and your professional lives makes a difference. I'm willing to believe that.
Thank you.
Well, we trust that. We trust that, Doug. Thank you. Bye-bye.
Bye-bye.